we are back, and we're moving into our first conversation for this morning, where we are having a broader discussion about the idea of disclosing COVID-19 patients' status and addresses to the Minister of National Security. That's the incident that really spurred this conversation. It is a situation that dives deep into the ethical boundaries within the medical practice. And so here to talk with us about this more, we're joined by three medical professionals. We have with us Dr. Jose Miguel, who is a general surgeon. We have Dr. Jose Antonio Marenco, who is a general practitioner. And we have internist Dr. Fernando Cuellar. Good morning.
Morning.
Good morning.
Good morning.
Thank you very much for joining us this morning and helping us understand this issue deeper. So I wanted to start off kind of broadly, being able to have you help us understand just what are the ethical guidelines within the medical profession when it comes to confidentiality. So whoever wants to take it can get started.
Okay, let me start, Arlene. I think there are two concepts that need to be put on the table right away, no?
Okay.
The ethical part, of course, and the legal part.
Yes.
Because I'm sure that I will have some rebuttal that they don't care what's our morality and what's our ethics, what's legal and what's not legal, no? So we do have to review the laws, and I did. And please don't tell me I don't know an attorney so I can't understand the basic laws, no? I'm not going to court because I'm not trained to go to court, but we have common sense. And if you look at it, indeed, there's a right to privacy, and also there's some exception to that right to privacy. And it spells it out for public health purposes. And I agree with that. I agree that there will be some situations where the right to privacy can be superseded by some other conditions. That's sensible, and I hope it's used at times. But definitely things can have been done differently than what was done with the creation of this SI, for sure. It just speaks to, lamentably, lack of communication, perhaps, lack of cohesion, lack of teamwork, because I see, for example, the person who signed the SI, the Minister of Health, basically threw his DHS under the bus and said you can become criminal, no? So obviously there was not enough discussion. And I hope that we can hear something from Dr. Manzanero truthfully, what really happened. But he seems to have been caught off guard with this thing, and going to the point where the National Security Minister has to have a whole list of COVID doesn't make sense. I mean, with the now in technology where we have chats and rapid communication, there can be easy communication between the two ministries to avoid any public health dilemma. And I can see providing a list will protect national security. Yes, it will help to minimize the spread of the virus. We keep saying it's all hands on deck, and that's exactly what it means, a coordinated, cohesive approach from the National Oversight Committee and the works. So I'll stop here and give my colleagues some space to comment.
Dr. Marenco?
Yes, my take on this is that there is what is called the Patient's Bill of Rights, and that is very much to protect the confidentiality of the patient. I guess the boundary is whenever the individual rights borderline with the community and the larger population rights. So, and in some probably very, very special circumstances, if the larger community is perceived to be at risk, then the individual rights have a little issue there as to how to keep it up. But all in all, in general, it has to be exceptional. And as I say, there is such thing as the Patient's Bill of Rights. to protect the information, especially medical information, from becoming out of in the public there,
Yeah.
which is something that we don't want. I mean, we don't want anything for our people, our patients, or even our own relatives, no?
Yeah.
So why do we want that for our patients?
Mm-hmm.
Yeah, that's more or less where I can see this.
Yeah.
Well, I'd like to mention that Belize operates within a whole set of rules and laws. Public health laws and medical practice itself is guided by oaths that has long been established from the times of Hippocrates. But the principle of confidentiality remains the same. The World Medical Association states in its declaration, Geneva Declaration, that the patient has the right to confidentiality. The medical practitioner vows to hold in secret, in confidentiality, the information of the patient, even after the patient have died. This is the basis of confidentiality and privacy, even in the presence of COVID-19 and a pandemic. Mm-hmm. However, there may be the practice is modified, so to speak, in the presence of the pandemic, in the interest of the public and the community at large. We will see that in pandemic COVID-19, for instance, there will be rules and regulations enacted to assure that information is used for the benefit of the public interest. We must be very careful in releasing confidential information. Medical practitioners may release confidential information of patients to public health authorities, medical or public health authorities. Okay, that is the general trend. I must make mention here that whenever a medical practitioner does so, he is not held accountable for such deeds.
Well, I think that's an interesting point. And one of the things I'm hearing very clearly from all three of you is that there is a fine line between maintaining that patient confidentiality and disclosing for the purpose of public health. But before we move deeper into that, we can clearly understand that any person has a right to privacy, and my medical information should be kept confidential by the professional that I go to, the doctor that I go to. But who governs this? What regulating body exists currently, just to help us understand, for medical professionals in the country for when they do breach things like confidentiality? Is it simply just a gentleman's word?
Not really, Marlene. We have the Medical Council, which is the body that regulates the practice of medicine. And if an issue, an event can be put forward to them where a client, a patient can show that their privacy was breached, that's the body that would hear their complaint and assess it, and indeed weigh in favor or not of if indeed that medical privacy was breached. So there is, and they are by law have the equipment to prosecute that medical practitioner if indeed it shows that there was a flagrant breach of medical information. This opens a lot of can of worms, because, for example, right away, I can relate to, for example, the national information system that exists, that has been heralded to be the best thing since sliced bread, but it carries a lot of medical information for different people, and it's a software. It can be accessed legally or illegally, and people are scared to have their information on a software that belongs to the government. I say that because in the private setting, that is indeed one of the reasons they come privately, because they feel like they are not protected enough. Their medical information isn't protected enough in a public setting. That's another debate, and it should be a debate because it's a real thing. But back to your question, there is a medical body that would protect Bill of Rights that Marenko said so eloquently.
And consequences?
Consequences, they are different depending on the severity of it. They will determine from a written a scolding, for example, complaint, and it can get as bad as to have your license revoked. I haven't had any recent memory of any of these, but there are wide ranging of consequences that exist, and there should be. And as a matter of fact, I would be one of them who would say that it needs to get even tighter. No, we need to have a council that's representative. I have a problem with the council makeup. I have a problem with how it's designed. There's a lot of political influence on the makeup and who selects the chairman, and that should be so. So hopefully we can mature more over the next decade or so that we can have our medical council do the right thing and have it out of the hands entirely of the politicians.
And just for clarity's sake, does this duty of confidentiality doesn't only extend between doctor and patient? Does it also include other medical professionals or staff, nurses, anybody who handles that information? How is that dealt with?
That is indeed a good point, David, because I go back to that software that exists, that different people have access to it. I know there are firewalls and they've tried to design it, but you know how data is and how can be accessed. So that's a problem. Definitely in the private setting, staff members, be it a lab technician, an x-ray, a nurse, a doctor, a cleaning person, usually signs an oath that they will not break this confidentiality, and they can be penalized if they do, from firing to legal action against them. I don't think that there's such a thing in the public setting, but there should be also.
Now, when we
There
go ahead.
is Dr. Cuellar, in the KHMH does have in its statutes confidentiality rules and regulations. The public health services at large, we would have to review. Maybe Dr. Marenko can correct me if I'm wrong, who worked in public setting for a long time.
Yeah, I lately, I was working at the Punta Gorda Polyclinic, and I'm aware that the administration there had make it its duty to have everybody in the staff, actually from the janitor, from everybody, to sign a oath of confidentiality, oaths of confidentiality. So, but whether this thing is an institutionalized activity throughout the entire public service, meaning other community hospitals or so, I wouldn't be totally sure about, but I'm aware that at least in this clinic where I used to work, it did happen. And so it's a kind of limiting compromise that the person takes whenever they sign that, because it is important for everybody actually to be not just the medical practitioner.
Now, from your experience, are there instances where if a patient tests positive or is diagnosed with a particular illness that you must report from your individual practice, whether if it's private, that you must report it? And how do these compare to what's currently on the table?
Well, Marlene, I'm glad you asked that question, because it doesn't only relate to COVID. No? We have things like HIV, we have things like dengue. And indeed, as a medical practitioner, you see the sense of reporting it, because it helps the country, helps the Belizean community at large, for them to know where are the cases of dengue, for example, how much HIV we have, tuberculosis, God forbid we don't have measles, which is a much more highly contagious illness. But in this COVID thing, there's been a lot of lawmaking, invoking the Quarantine Act and all the public health acts that indeed have forced us medical practitioners to report it. I think it actually came out of the DHS office to remind us that it's something that we have to report the cases of COVID. And I see some sense in that. I definitely would want to continue cooperating with the larger medical community at large. I don't see to report it to the Ministry of Health, because the data will serve the country for us to improve, to get over this. Yeah. But I do have the issue of it being necessarily have to be reported to the national security. Yeah. And I go back to that same thing that started this discussion. I was amused that the Attorney General said yesterday that the justification of such SI is that it's to take out the discretion from the DHS. So DHS doesn't have common sense, brain, medical training, has a team. Who has the discretion? Is it himself, the Attorney General? Only the people them have brains? What's going on with the oversight committee? I mean, it's preposterous that such a thing was said, that it was to take out. So it would mean that the DHS would say, no, I want to release this name, but I don't want to release this name. Come on, man. This is a team effort. Well, I think, okay? And it's insulting. It's insulting to the DHS office that they would not have the discretionary capacity to manage data.
Well, this just to continue that, that sort of speaks to the larger issue when it comes to when it comes to choosing who is going to be the one to make these decisions as to whether or not to disclose, patients' confidential information. Because, as all of you have said, it seems that, there are circumstances where the release of confidential information or patient information might be warranted to help the country. But even if you look at the law, it says that it should be that these limits on the confidentiality or whatever should be to for the purposes of preserving or protecting public health. Mm-hmm. But it would seem that the best persons to decide to who or when that should take place would be the medical professionals themselves.
Thank you very much, Mr. Courtney.
The situation
for once I hear attorney giving some kudos to the medical profession.
The matter here, if I may, the matter here is confidentiality versus public interest. Yes. The confidentiality is extremely important and is a right for the individual, for the patient. Yeah. At the same time, governments, and I'm not saying Belize only, but governments, India, Jamaica, wherever, have the duty to preserve the public health interest and of the nation, of the people at large. And those circumstances tend to override in occasions, specific occasions, pandemics, for instance, the individual interest and confidential and privacy. And that is why we have seen such laws being enacted in Belize in the interest of the public. But may I say here that information of patients may be released to public health authorities, and those will decide what to do with that information. I must say here as well that any medical practitioner that may release information required by a court of law or by any instrument of law is not held accountable for that release of information. That I must stress very clearly here. Any public health worker or allied health, meaning doctors and allied health professionals, must not be held accountable for the release of that information.
So if I'm understanding you right, what you're saying is that based on what you know with the ethics that you are guided by, if a law is created that forces you to disclose your patient's information, diagnosis, whatever it is, you can comply and not break the ethical code.
Exactly.
Okay.
But I want to go back to Mr. Courtney's specific question about who is responsible for disclosing the information. Again, the health authorities, the Ministry of Health I would say not put it on one person, the DHS himself, but we do have an epidemiological unit, which is a body of people that can make a decision whether or not it's in the best interest of the public health to disclose such information. Easy. Yeah. And we need to give the Belizean public more credit than is being said, because on the ground here, if I have a patient with dengue, I would discuss with them, you know, Mr. X, Mr. Y, you have dengue, I need to release this information to the Ministry of Health. And they, 99% of the time, are in agreement to say, yes, doc, we agree, we understand that it's in the greater good of my neighborhood, of my community, and we have that cooperation once there's dialogue and proper communication. So it's just about that, you know. It's not about national security trying to fight with the Ministry of Health or have a pissing contest and see who is stronger and bigger and badder. But Lord, man, let us work together, okay? And it's an easy thing. It's not rocket science. We didn't have to come to this.
And, you know, speaking of also, you know, that whole decision-making process doesn't regard also have to be had to sort of the extent or the limit of the information that we will release as well? Because shouldn't there also be someone to say that, well, even if we recognize that this is a pandemic or there's a public emergency, we need to release certain information, but somebody also has to be there to limit what kind of how much information is going to be given. So, for instance, in this case, is it going to be just the positive diagnosis? Is it going to be the underlying conditions as well? Is it going to be, I mean, you know, in addition to the addresses of the person, all of that is also a huge hugely important as well. So,
of course, Mr. Courtney, of course, and that's why I go back to a body of people, 3 people, 5 people getting together on a daily basis to see what information, what extent of information would be released, because indeed we could have an HIV positive patient contracting COVID, and would we need to release that the person is HIV? Would we need to release that the person is diabetic? I don't have the absolute answers, but I'm sure that we can come together and work together and have these questions fleshed out.
Yeah. Let me get back to another point, because I don't know if we clarified it fully. Dr. McGill, when you spoke of the situations where health information is disclosed even from the private sector to medical authorities. So we're talking cases of HIV and we're talking cases of dengue. There is a difference in that disclosure, just simply as to who you're going to tell. Do you want to get into that deeper?
But of course, the information that is released from the Office of a medical practitioner is to be released to the public health authorities and only public health authorities. Mm-hmm. Okay, and I mean, let's take for instance the COVID-19. The information that is picked up, let's say in Cricketsarco, will be released to the surveillance unit at that area. Okay, then the surveillance unit will be the entity that will be working with that information for the benefit of the public and society at large.
Yeah. So like using the example of dengue again, which is one we can use. You give it to the public health officials and they may go into that community and spray, but it doesn't go beyond the health community itself. Is that what you're saying?
Yes.
Can I make a point?
Dr. Marengo, please.
Yeah, I think we need to make a differentiation between what is the reporting system and what is disclosing information.
Okay. Mm-hmm.
The reporting system is set in such a way that any of the identified communicable diseases be reported through the normal epidemiological channels of the Ministry of Health. That is, whether it is cholera, whether it is HIV/AIDS, whether it is dengue, etc. That is what we call a reporting system. There is even a reporting system for dog bites, for example. whereby a medical officer who sees a person with a dog bite in his clinic need to report it to the public health inspector. This is a reporting system. In my opinion, this is totally different than disclosure of medical information or different. It goes in a different way. So I think we need to just make that little differentiation there.
Thank you. Thank you for that explanation there. There's a broader issue at hand as well, and I think being realistic about what we're facing, COVID-19 is new. People are very concerned about it. And there has been a pervasive stigma that has been associated with people who've come in contact, who've tested positive. You know, we got stories from San Pedro when the first cases were identified that they were getting death threats. And so I think that it clearly shows that there's a level of fear that people have. So when you think of disclosing, releasing somebody's private medical information to a separate ministry from the Ministry of Health, how do you think that will affect the situation of the stigma and discrimination and potential future testing of other patients?
That's an excellent point, Marlene, and it also brought to mind an issue that was put forward to me last night, where we would have people in the community saying that they think that they would have the right to know who is COVID positive or not. I don't think they have the right to know. They would want to know, but it's not a right to know if your neighbor is COVID positive. So then you would also have the right to know if he has had syphilis, for example, or she has had syphilis. So it's a no-brainer that they don't have the right to know who is COVID positive and COVID negative. But again, back to your particular point about the stigma, I think we have seen a curve, a transition since March. It happened all over the world where there was a lot of fear and panic with COVID. And I think it's lessening for sure that we have a less stigma. Even in the medical community, we were fearful to attend to patients with COVID positive, but we have learned, thankfully, of how best to manage these patients. So I do think that if you release information to more and more people, it will indeed cause a negative effect and will not be helpful to minimize, to lessen, to eradicate the stigma of these things. I see no need. I'm hoping that the Attorney General can provide us with a better explanation and not just taking out the discretion from the DHS. That doesn't make much sense to me. I would think that maybe there was a broader, stronger reason for national security or insecurity purposes, instead of just his answer of, oh, well, we want to just make sure that we have the sole discretion. All
right, so this is being framed as an issue of public safety, and so what we're going to do is take a very quick break, and when we come back, we're going to look at it from the other angle. How does this help, or what needs to be done to address the public safety issue here? So we'll take that break, and when we come back, this conversation continues.
If you're looking for low-cost television advertising, have we got a deal for you? Advertise on Channel 5's Daily Classifieds. Channel 5's Daily Classifieds is one of the most effective methods for introducing yourself and your business to the community. Use our Daily Classifieds to recruit employees, promote specials, promote your products or services, promote a business opportunity, increase traffic to your website, and advertise items you have for sale. Let us help you save valuable time and money. Call us today at 223-0146 or visit us at our offices on Pony Drive to discuss how we can help your business grow affordably. Channel 5's Daily Classifieds. Advertise today.
For over 20 years, Great Belize Television, Channel 5, has been the leader in award-winning local programming. We have also produced some of the best video commercials, documentaries, and live events for clients countrywide. And we continue to offer high-quality production services to maximize your advertising needs for your business or organization. From concept to completion, let us help you achieve your marketing goal by producing your commercial, documentary, graphic animation, live event, or even designing your website. Using state-of-the-art equipment and experienced personnel, we can make your ideas come alive. For more information, come see us on Coney Drive or give us a call at 223-0146 or 223-7781 or email us at gbtv@dtl.net. Great Belize Productions, making great television in Belize.
Should COVID-19 positive patients' name and addresses be disclosed to the Minister of National Security? That's what's in the recent SI. As far as we know, new options are being put forward. We're having a conversation this morning with 3 medical professionals, just weighing in, understanding more about the medical ethics that they're guided by. So we have with us, if you're just joining us, we have Dr. Fernando Cuellar, internist, Dr. Jose Miguel, a general surgeon, and Dr. Jose Antonio Marenco, a general practitioner. And so we started off the first segment getting a better understanding of the ethical guidelines that you practice under. And one of the things that I think we clearly outlined is that in general, a patient should expect their private medical information to be confidential. But there is the very fine line where in the interest of public safety, you can disclose that medical information. And that's where we are today. So let's put the perspective of the other side into this conversation, and I can get you to weigh in. Our police officers are charged with enforcing the Quarantine Act. And so they have to go into different homes, break up parties, make sure people are social distancing, wearing their masks. They may pick them up, they may take them into the holding area. All of this interaction is taking place with the public. Now, for their safety and for others who will have to enter, and for those who are knowingly breaking quarantine when positive, self-isolation if they're under investigation, knowingly leaving their homes and going into other spaces, this is a part of the justification as to why it is deemed that this new amendment is necessary. What are your perspectives on this issue?
I think it's a valid point of discussion, Marilyn. It's valid, and definitely us medical community would want to participate, cooperate as much as we can to minimize the transmission of the virus. Along that same line, I am hopeful that we start to engrave in people that everybody that believes have the virus unless proven otherwise. Mm-hmm. Okay, remember now a lot of asymptomatic carriers are there. We should also think that 85% of people with the virus will have mild symptoms, etc. Okay, so everybody believes, and I'm hoping that the government, the Ministry of Health can pull that as a message that everybody that believes have the virus until proven otherwise. Mm-hmm. And that will take away that whole thing that we have to have this little list available for COVID positive patients. And I'm saying that there must be mechanisms that the police and the medical community can share. Lad, one WhatsApp chat group can be started, and within an hour you could get information directly. If you want to go to Sunrise Avenue where I live and see if the house any COVID positive, you could ask directly. Sure. I mean, in a matter of an hour, you could get based on our technology nowadays. So we don't have to have a list sent of all of this thing, man. Come on. I am sure the oversight committee have people with good sense for develop a system that can do that properly. And the police officers have to treat everybody like they have COVID positive. And that's what we tell people in the health facility. Wear your mask, put on your shield, and wash your hands, disinfect, because the man with the dog bite that comes in might have COVID positive.
Any other thoughts?
I believe that with that, what just Dr. Cuellar says, assuming that majority of the population in general could be a potential carrier, or the need for a particular list or so becomes redundant. There's no need for that. If we all assume that anybody else could be a potential person who transmit the disease, why going in that direction? And so I think the effort of the government should be geared towards providing those policemen and women and those persons in the front line all the necessary protections, assuming that anybody they get in contact with could be infected. And also educating, stimulating, promoting all those already mentioned and assure activities that will protect us, like Dr. Cuellar said, the mask, the washing hands, the keeping social distancing. So I believe that's where the effort should be, and protecting those in the first line. And because, to be honest with you, if we think like that, so many people can be potentially infected, why the list? If we're assuming that anybody could be, there's no really justification for a particular list.
Dr. Marenko, you are a public health medical practitioner, I understand. The situation here is developing a robust public health system where we have reporting from across all components of the network of the health system. Once you have a robust public health system, then there is very little need to have other sectors other than health to control the pandemic. What we need to do is to empower the public health system. Am I right, Dr. Marenko?
Well, I am 100% with that, but I take it in such a way that there are some areas where the public health system may need the support from the private sector. That's why I've always liked the concept of public-private entrepreneurship, public-private relationship, whatever we want to call it. There is no way a private or a public system, health system by itself, can address the need of a population. So public-private coordination, public-private, I would say, cooperation is what we need. No, I like to see, for example, Dr. Arriaga, Dr. Cuellar, and Dr. Hidalgo heading this COVID-19 situation in Belize, which is excellent. And yesterday I was hearing the experience of San Pedro when it comes to their response, where they involve private practitioners and so on. That cannot be any better than that. I mean, we need to have a close relationship. Actually, when the Belize Health Information System was set up, the public-private interconnection was very much in the front line. I mean, I don't see where or why we are people who are in the private sector it's not taking part of the Belize Health Information System. It's the Belize Health Information System. It's not the Ministry of Health Information System. It's the BHIS. So how much of the BHIS are those who are in the private sector utilizing? At the end of the day, it should be in the best interest of the patient. So I'll just put it that way.
Do you think, gentlemen, that in a situation like this, it would be perhaps up to the patient to decide if they want their information to be disclosed?
Yeah, that's a good point, and I think Ms. Matura had put forward some suggestions of patients signing documents, whether or not. But I do think that it does rely on more the medical community, medical public health system to identify potential risk for the public health.
Yeah.
And not leave it entirely to the individual, because they might not clearly have all the tools to make that decision. But if I have, for example, and Dr. Marenko said something very simple, a dog bite. Dog bite is important to report, because we need we need for the cooperation with the, I'm not sure who is now doing that, it's Baha, I think, or the public health inspector, to make sure that the dogs are properly vaccinated. So there are some, and there are a lot of issues that the medical community do have to take the lead, and not just leave it to the individual themselves. One of the things that sticks out in my mind quite clearly, for example, and it's a dilemma I face regularly, is the HIV status of people. HIV status of people are discovered, and some people refuse to disclose it to their partners or to their families. And we are sometimes left with that dilemma as a medical person. Do I disclose it to the couple, or do I disclose it to the family? And I personally never had to go against the individual's wishes and say, you know what, it's for the greater good of the family, it's the greater good of more than one person, and I will make this judgment to disclose it to other people.
It's, when you think of the issue of public safety, and especially because there still is a lack of awareness and education, because clearly people who are COVID positive, who knowingly goes to their grandma house or to a family barbecue, they don't understand, I would assume, or are just completely malicious in still exposing others to COVID-19. And I think that's really the challenge that this amendment attempts to address. So I want to ask, given that as the situation that may be occurring, do you in any way support some version of disclosing the COVID-19 the information about COVID-19 persons?
I'm not sure if I want to use the word disclosing, and yes, I do support some version, but that version should be left to the health authorities, to the Ministry of Health. Yeah. They have enough common sense education experience that the epidemiological unit can identify and track and reinforce the whole public health surveillance. Mm-hmm. That doesn't need to be going to Ministry of National Security. Then next week we hear that the Ministry of Foreign Affairs might need it for some strange reason. But the health authorities should be the one in charge of that and enforcing it. But it's all about working together. It's all about working together. It clearly showed this whole thing that the Minister of Health signed this thing without, and I'm hoping that my colleagues in the public health can be truthful. I hope that Manzako come out and say, this is what happened. And that's a problem I've had with public health colleagues. The past CEOs, the past DHS, they know that the system is dysfunctional, but they choose rather not to say anything. Mm-hmm. And I challenge everybody to be truthful and be effective. If we really say we love this country and want this country to go forward, then do the right thing.
So your position is keep it within the Ministry of Health. Exactly.
Okay. And reinforce it, yes. The police reinforce it, but not make it be one blanket carte blanche thing that you just, and you will be criminalized if you don't. Imagine.
Yeah.
Well, I think that speaks to a very important issue in that the main point of, and we're looking at, again, this is the Quarantine Act, and so at the end of the day, even if we go back to the original discussion about the limits to the right of privacy, the end goal needs to be how best to manage, contain, reduce the spread of the virus. So, I suppose you have to ask, what are we really accomplishing by providing a list to national security at this time, or creating a law that provides for disclosure in this way? Yeah. Is there, or let me say, or should I put it like this? are you then saying that, or should we just leave it up to the health or the Ministry of Health or whichever public health body to be the main decision-making body, because they ostensibly would be the best persons to choose or to decide how best to contain the virus?
Yes, Mr. Courtney, I think we're going in circles a little bit. That's the bottom line. And this is a government, this including different ministries, and they get support from the police and the Ministry of National Security. Marenko said it, that there's reporting, and when needed, they call in and say, you know what, we have a strong, robust surveillance system. We are seeing that this person, COVID, has breached their quarantine, which, by the way, our whole public health laws and quarantine laws need to be revisited big time, because it's archaic, okay? We need to, hopefully within the next decade or so, we need to modernize these laws. They're very old. And going back to your question, yes, we need to have the Ministry of Health, a group of people, epidemiological unit, their surveillance, and when needed, they rely on the national security / police to enforce the quarantine.
Yeah, because we don't even know the chain of command after this information is passed on to the Minister of National Security. Does it then go to the commissioner and then to the different stations and then to the patrol unit? I don't know. We don't know where it goes. Yeah. But I want to ask, okay, let me get the rest of your positions. Dr. Miguel, what are your thoughts moving forward?
Hello, Belize.
Yeah. Dr. Miguel, what are your thoughts about moving forward? What are some of the ways that we can address the public health issue, but still be respectful and ethical in how we maintain personal information?
I have seen that Belize has been learning, Ministry of Health, all the authorities, the private sector as well. Yeah. We have been learning as to how to manage the pandemic scenario, so to speak. We have to be careful in our behavior. Yeah. We shouldn't be shy in reporting. There has to be a collaboration between the public health and the private sector to develop and control the pandemic. Those rules and regulations that are enacted need to protect both the public interest and society and the individual's interest of the patient. All healthcare providers, all doctors, nurses, should advocate for the patient, for the benefit of the well-being of the patient, and also not lose focus for the society's health condition. Yeah. That is where the different actions of the government may come in to legislate to protect the society.
Yeah. Dr. Marenko?
Okay, I believe there are different levels of protection, I would say. Number one is the doctor's-patient relationship, and that is at the individual level. At the government level, the position of the Director of Health Services, ever since it was the Chief Medical Officer in the past, when we used to have permanent secretaries and so on, the position of the then CMO, now the DHS, have always had a robust legal power, I would say. No? That position has a lot of power, and so I believe the politicians, the political aspects, should respect, the position of the Director of Health Service. Actually, if we put the Director of Health Service there, it's because we trust, or I hope, that at the time of selecting, the person is selected, trusting that the judgment, the character, etc., of that person is somebody who we, the entire medical community of a country, can trust that person to make the right decisions especially in times of pandemic or epidemic or quarantine or whatever the case may be. So to cut the long story short, I would believe that we need to support, strengthen the autonomous functioning of the Office of the Director of Service, and try to avoid this be much influenced by the political levels. No? Yeah. So I would think that that is where we need to strengthen our position.
And speaking of autonomy, we haven't heard anything from the Belize Medical and Dental Association or the Medical Council. This is at its core an issue that has to do with the ethics in medical practice. Why is it? I mean, is there something that is coming, or do they normally not weigh in on issues? Do you think they should weigh in on this issue?
Let's go, Mugs. Start.
Well, the Belize Medical and Dental Association is part and parcel of the Medical Council. Mm-hmm. But the Medical and Dental Association does not come up and make statements all the time. But behind the scenes, so to speak, we are participating in each and every activity in the function of the Medical Council.
Okay. All right.
Well, the disclosure is that Dr. Mogale is the president of the BMDA, no?
I am aware of that, but he said he's general surgeon today.
Democracy works slow, so I think for him to represent the BMDA, they'll have to do meetings and that kind of thing. Yeah. And I have no expectations from the council to say anything because of the makeup of it. No? And again, and that needs to be changed.
Yeah. And ideally, it's speaking out for your profession. And I know, it's not always easy to get people to come on board to speak on these issues. You're not necessarily taking positions. You're simply helping us understand. And where we may see it from a perspective of our own personal gains or personal safety, you have a better understanding as to why issues like confidentiality are critical to your profession. Just in closing, anything that you would like to say in terms of, because we missed a very critical point, and I think Dr. Marenko, you said it. Really and truly, disclosure is unnecessary if we all work or we all function as if every single person has COVID. As far as we know, when it comes to people who work within the Ministry of National Security, they have been gifted with a lot of personal protective gear that should help them in prevention. Is that part of where we need to strengthen? Should we be strengthening awareness for COVID-19 positive persons to understand why they need to isolate? And also, maybe you guys as medical professionals can talk with the national security personnel about how to properly protect themselves to reduce transmission.
I think that is undergoing to a certain extent, Marlene. I know of Mr. Chester Williams trying to educate and sensitize his police force, and I do see on the street evidence of that. I mean, there's always need for ongoing education and sensitization and training for everybody, the customs officer, the famous frontline workers. No? Yeah. So it's a work in progress. We are just 7-8 months into this, and we have at least another year of talking about COVID. So it's a working process, and it's a cooperative, and hopefully the National Oversight Committee, who is the coordinating body, can do that and not have these mix-ups happening, not this thing that brings us out to discuss whether or not the DHS. And by the way, I hope I'm a constructive critic of the DHS himself. Kudos to him, he's doing a good job. He's actually the face of COVID in Belize. And so when necessary, we criticize him, and when necessary, we support him. Yeah. Of course, and that's the way it should be done. And if I'm allowed, we have other issues to talk about, the drug plane landings, we talk with ghost cargoes. I want to talk about the gang violence that affects the health industry, the motor vehicle accidents. So there's a lot of things that the Ministry of National Security can reciprocate. I want to see the list of gang members, for example.
Okay. We'll just leave it at that. Any closing points, Dr. Miguel or Dr. Marenko?
Go ahead, Dr. Miguel.
Thank you very much for inviting us. We want the general public to understand that medical practitioners will always advocate for their rights to privacy, right to health care, right to good and maximal medical care. This is the strength of our practice.
Okay. And from the South, Dr. Marenko.
No, I would just emphasize the personal responsibilities, when it comes to this. The more we adhere to those measures, the less need the politicians will find to try infringe in our particular rights, individual rights. So just stick to the rules, and the more it's proven that those measures are effective. So why do we have to waste energy and time and money doing other things that distract us from what is the main message? Meaning, protect yourself. By protecting yourself, you protect others. And I believe if we just think in that fashion, there will be no need for all these kinds of sometimes arbitrary measures that don't have any real positive effect.
All right.
That's one.
Gentlemen, thank you so much for joining us for this conversation. We appreciate it, and stay safe.
Thank you.
With that, we're going to go ahead and take a break. When we come back, our focus will be on the tourism industry. The Belize Tourism Industry Association joins us to explain to us why they feel there has to be a rethinking of the existing COVID strategy when it comes to tourism. That's coming up after the break.